Viewers, let we discuss the medical education cycle and, of course, the 8 principles to guide educational practice and health. This is very important to understand the medical education cycle as it is necessary for the healthcare professional. So, what is education? Education is the process of facilitating learning in perspective of learning domains. And you know what are learning domains? The learning domains are acquisition of knowledge. So it is called as cognition or cognitive domain. And the skills relate to the psychomotor domain. You see, so this is the scientific terminology, and the values, beliefs, and the habits that relates to the affective domain. So these are three are the learning domains, and you're quite familiar with that. So, what is important regarding education, since it is facilitation of in perspective of learning domains, therefore, in medical educations, it is the facilitation of learning process amongst the healthcare professional. Remember, so nothing is different than what we are merely educating our healthcare professionals, including physicians, nurses, pharmacists, paramedics, so all cadres of healthcare profession, including the dentistry as well. So medical education is very important so as to produce quality graduates, medical graduates in the field of healthcare system so that we can deliver. Now, important point is what is learning? Learning is something related to feeling, that what you feel, what you think, and of course what you watch and what you do. And these four phenomena gives you learning, and this learning is called as experiential learning. So the man learns by experiences as well. Now, as I refer to that 8 principles to guide educational practices mean that how can we educate our students, our learners, uh, uh, to have a trickle down effect so that they can learn it, what you can say, as a deep learner. So the first one is there should be an active mental process, mean that we have to activate the learning and modify the previous knowledge. Remember, the previous knowledge refers to that the students have already some sort of knowledge in their brain, or the learner have some sort of knowledge in their brain, and we have to activate and modify. Activate and modification mean that we shall produce an opportunity for them to learn. And activation is not so simple. For that, we have to produce learning opportunity, and once we produce learning opportunity, then the student shall have the flavor of self-directed learning, and of course sometimes directed self-learning as well. And the teachers and the peer discussion is in the second process, you see. So the next third principle of educational practice is that the learners should be given a challenging task, and then so as to promote set together a team-based work. Remember, so as to promote a team-based work. Mostly the teachers gives an easy task which is not challenging, and if the task is being not a challenging one, then they will not learn, or the learning process will be delayed, you see, or rather there will be compromised learning. Then the fourth principle is that they should be learning for what? So the learner should have a deep understanding in the real world problem, and once they are floated in the real world problem, then they can practice very easily. And the next principles in educational practice is that the learner should be completed or should be given an opportunity to complete the experiential learning process. It means that once the learning process is activated, then this whole cycle shall be completed, and it shall not be ignored, it shall not be slowed down. Sometime a good teacher start and initiate and stimulate this in the mind of students to facilitate the learning process. But the difficulty is that if we are not being able to ask about that, to have a feedback about that, then the process is not completed. And once the process is not completed or delayed or retarded, then it is difficult to have a concept mapping. Thus, 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 it creates a concept matrix. It promotes a concept mapping, and this concept map makes the person deep learning. The next principle is that the learner is to be given a practice opportunity for their self-assessment and constructive feedback. And once there is constructive feedback, you see, then they will review and revise their actions. Consequently, the learners will get their cells corrected, and the addition of knowledge that they have gained, the gained knowledge will be assessed in the real world environment, and thus, thus they will become a deep learner. So important to understand is that the learner should be given opportunity for reflective writing as well. Usually this part is missing, or in medical schools or in healthcare institutes, this is taken just as believed for granted. This is an important point where if we are successful in writing a reflective portfolio, or if our writing, or what you can say, a reflective one, then it will have uh, a trickle down effect on the curriculum review as well, because this reflective writing is going to have a hammering effect on the curriculum of relevant discipline, whether that is medicine, dentistry, pharmacy, or nursing. So what is important? Important to understand is that once there is reflective writing, it shall be presented in the community of practice. And what is community of practice? It's in fact, the premises, the real premises where the clinician works, whether that is the senior registrar or junior registrar or clinical pharmacy or basic scientist, you see, and the community of practice include all these, even including sociologist, you see. So the sociology discipline is being entered, and consequently, what happened? This completes this whole process, and what it does, it makes the learner much more deep learner, and that it facilitates the learning phenomena and learning process. Now, once we understand these 8 principles to guide for learning practices, you see, then let me understand the medical education cycle. And the medical education cycle, you see, the first key indicator and the leader one is the teacher. And of course, there is curriculum material, there is the teaching methods being adopted in a particular curriculum, and of course there is assessment methods, whether that is formative assessment or summative assessment or programmative assessment, and then the clinical setting, or the real world environment where the healthcare professional goes and their practice. So there is another, what you can say, the partner of this whole cycle, that is the learners. Learners mean the students, they are learners. And remember, indirectly, the learner, the teacher is also a learner. The teacher should also be a learner indirectly, remember. And it is the indirect learning phenomena that makes the teacher emotionally intelligent to deal with all caliber of students. So they are learners, and the learning experiences of the student being in that real world environment. And then it is development of the learning domains, because once the man experiences his learning, so what happens? His previous knowledge is being what you can say, exposed to the certain experimentation, and this certain experimentation will add on to him much new knowledge, whether that is in shape of experiential knowledge, or related to cognitive domain or affective domain or psychomotor domain, and then it leads to the best practices with the patient consequently. So the best practices with the patient, and then followed by the improved patient's outcome, whether this outcome is clinical, humanistic, or economic outcome. But nevertheless, the target is better for the improvement of the patients, because patient is the most concentric part in the healthcare system, where all healthcare professionals, including paramedical sciences, medical sciences, and of course, whether that is physician or nurse or dentistry or pharmacy graduates. So their main focus is on the patient's quality of life, patient clinical success rate, and the patient, what you can say, even economic outcomes. So uh, another important flavor of this medical education cycle is the cognition and of course the metacognition. Cognition means something that relates to that you think, that you perceive in perspective of your knowledge, previous experiences. And metacognition means that it is cognition of the cognition. So you cognitize what you have already felt, or you have an experience. This will lead to an orbit, a circle of professionalism. And what is professionalism? So it is something that we expect from a medical practitioner as his level of competence, clinical competence, and of course that physician or the healthcare professional shall be emotionally so much intelligent to deal different caliber of patients, you see, as per what we expect from the physicians and healthcare system, and or the patient expect from these healthcare workers. And then of course accountability is the next leading role as a professionalism amongst the healthcare professional. And of course the role model. Role model does not mean that he is going to be as an example for the students. He is going to be an example for the all stakeholders in the hospitals, you see, and the work area. So role model does not mean to be a teacher, a person to be a good teacher in the classroom, but he should be a good role model at the premises or the work where that practices. So a clinician should be a good teacher in the class, but he should be a good practitioner and role model for the students at the work level or real work environment. I mean, in the hospital or the clinical setup. Thus, role model is the key point in professionalism. And once this orbit is increased, you see, so your previous knowledge to your previous knowledge, whether that is our skills, the new knowledge is added. Once that is added, so the whole circle is now increased. And you see, and it goes backward, you see. How it goes backward, that this orbit, as time passes on, the man learn by experiences, and consequently he is now having the flavor of reflective writing as well, as I refer to it earlier. So thus this reflective writing is going to have an impulse on the curriculum, as I refer to in the previous slides, and the curriculum material. This will subsequently lead to what you can say, curriculum review, and if needed, subsequently need as curriculum revision. Thus, thus the medical education cycle is a continuous cycle, and it includes the teacher, the learners, and of course even the workplace environment, and professionalism, continuous professional development, and role model. I hope now you understand the cycle of medical education. Thank you.